thanks for coming back. This is your girl Shanique and welcome to my page Shayventure. So in today's video it's going to be a little bit different. It's not going to be my adventures in traveling. Today will be more of my adventures in the nursing field.
Baby wanna drip, don't even trip. Flexing that whip with a diamond on her wrist. I got a chick, nobody can hit. I put her in, the diamond on her ring, yeah. She all about me. In them tight shorts, she can even see the cheeks. Bad B running up down through the streets. I ain't even lying, she better than me. She better than me. Big boy sweat off, never sweat off.
What's in my nursing bag, basically what I bring to work. You probably notice a lot of nurses will stuff their pockets with stuff, or maybe they'll have like a fanny pack, a belt that goes across their waist, and they have everything stuffed in there. So for me, literally probably the only one on the floor, got a wristlet, and everyone knows it's me. Got my name on the back and everything. So this was given to me from my nurses union in my hospital, but honestly it's really good. Like, it holds so much stuff in here, and it's cute little designs. Says thank you. It's really nice, and it lasted for a couple years now. That every nurse needs, every nurse always looking for, every nurse needs pens. Like, this is the most important thing. I usually try to bring 2 colored pens, so you know, you have your information in one color, then maybe the more important things you'll put like in a red, blue, or you know, any other different color ink that you may need to point out to your eyes like this is important. So this is most important to a nurse. You're always losing it. I always start off the beginning of my shift with 1 pen, but at the end of the shift I have none. I'll come in with 3 and I'll have none by the end of my shift. Like, it's just always gone. So also a good thing is to probably label your pens with your name on it, because it will go missing. Either another nurse will take it, a doctor, maybe leave it in a patient's room. Pens is the most important thing. Even jot stuff down on your hand on a piece of paper. Pen, this is the go-to for nursing. So the second thing I want to talk about in my bag, second thing, scissors. You're like, why you need scissors? It comes clutch, I'm telling you. For one, in labor and delivery, we would cut the mom's name out to put on the little band that her and the baby has. So that's when I would use the scissors usually. Or sometimes the patient's gown is tied really tight into a knot. I don't know how, I don't know why they do it. So I cut it, because if there's an emergency or if we're trying to get this gown off for you, I'm not gonna struggle with it for another minute or 2. Cut if you're trying to do something with the IV, maybe it's too much tape, or you're trying to fix the tape, cut it. Let me see. Basically, you never realize how handy this comes in until you have it. Honestly, I don't even try to untangle anything. It's
Cut it, cut it, cut it, cut it.
so something for me that I usually put in my bag is Vaseline and lotion. So let's be real, 12-hour shift, you're gonna get dry. Dry lips is not cute, cracked lips, bleeding lips not cute. Dry hands, let's be real, we wash our hands a lot, hand sanitizer stations everywhere, and you feel dry. So these 2 I usually have in my bag to just feel moisturized and not feel dry. I don't know if other nurses, maybe they just have the lip balm, but it comes really helpful. Another thing that's kind of for me is snacks. Like, everyone who knows me, I'm a job, I munch a lot. So I always have some type of snack, chips or bars. So I try to be healthy, so I try to have Nutri-Grain bars in my bag to have, because I work night shift, so you do get hungry in the middle of the night and you're not trying to put on the pounds, so at least I try to put on the healthy pounds. So that's another thing that's in my bag. So back to, actually no, something else that's for me. Contacts. I wear contacts. I switch it up, sometimes glasses, sometimes contacts, but I usually bring my keys with me when I do have my contacts on. Still got room in here. The other thing in my bag that I have in my bag are gloves. I have an extra pair of gloves in my bag, or maybe a couple stacked up in there. So for one, I love a small size, but medium is doable. Large, I'm struggling. So sometimes it's handy to have an extra pair or 2 of gloves in your bag or on you in your pocket, just because if the room doesn't have the size gloves that you want, then you have to leave the room, find storage to go find the pair of gloves that fits, And also, if there's an emergency, you need to put on your gloves right now, or say something's happening really quickly, you just put on the gloves real easily and then, you know, attend to whatever you have to do. So I think having a pair of gloves on you, in your bag, near you, is very useful and it comes in handy without even realizing it. Another thing in my bag, I would say, is a reflex hammer. I think this would be more useful for labor and delivery, maybe more neuro nurses, but I don't remember using this as much in med-surg, but definitely labor and delivery when you're checking the mother's reflexes while she's on magnesium, and probably also when you're a neuro nurse, make sure their reflexes are working and not suppressed. So this comes in handy and it's in my bag. Another thing that I have that is handy is when I started labor and delivery, I came from med-surg. I always knew I wanted to do labor and delivery, but I didn't remember everything from nursing school, and who can remember everything from nursing school? So I bought this little OBGYN notes, but it's very helpful because it'll have GYN, antepartum, intrapartum, postpartum, newborn and pediatrics, pediatric assessments, basics, and acute. So basically all of the pregnancy you'll have here and how to help, and also with the newborn care is here too. So I don't have any kids, never been pregnant. So some questions the moms may have, I'm like, I don't really know how to answer this, I've never been pregnant. But it does have some teaching, like patient education sections too. So you can explain to the mom, okay, this is normal, this is supposed to happen. And it also helps with the breastfeeding. They had a section or a page on breastfeeding, how to help moms breastfeed and how to position a baby. Of course, never did this. So it's always good to have extra backup and a diagram too to even show the moms real quick. Here it is. Because yes, I can go print it out, but at least like on my person right now, I have this little book I can flip to a page and show them real quickly and then print out the information later. And the last two things I'll say that's in my nursing bag. Band-Aid, just in case you ever cut yourself, you know, paper cut, they hurt. Just have a Band-Aid there. Scrunchie for your hair, always gotta have your hair up or pulled behind. And I had this, especially during the whole COVID pandemic, we're wearing masks more often than usual, and it would hurt the back of the ears. So when my coworkers actually gave this to me, you just attach it to your mask and, you know, put it back here, and it just helps with the pressure. So you don't have that string behind your ear putting all that pressure there. So this was really helpful, and basically that's it. This is all that's in my bag, so thank you.